Patient Teaching Diabetic Ketoacidosis by Ashley Merritt, Anna Fraser, and Chigadili Ubaka.
Top story is about young teenagers developing severe symptoms related to diabetes called diabetic ketoacidosis.
Diabetic ketoacidosis results from dehydration, not taking your insulin, and high blood sugar levels.
We have a 19-year-old patient that has type 1 diabetes and was diagnosed with it at the age of 6 years old. She was admitted to the unit with diabetic ketoacidosis and an abscess in the groin area. The patient is 5'4" and 260 pounds. She smokes, does not exercise, and has not been taking her insulin. She claims she forgets to take it and relies on her mom to administer the insulin. She eats very unhealthy foods and does not know how to cook. Well, I'm looking at your chart right here, and it says that you take Humalog, which is a type of insulin. Have you heard of that?
No.
Okay. What Humalog is a rapid-acting insulin.
Rapid acting?
Yeah, and by rapid acting, that means that it starts to work in your body very quickly. It's going to bring your blood sugar down within about 5 to 10 minutes. You need to make sure you eat a snack with it, because if you don't, it can bring your blood sugar down too low.
Oh, okay.
Do you have any questions for me about Humalog, Sarah?
So, are there any special directions I should follow when taking insulin?
There are, and we're going to go over that in a few minutes.
Oh, okay.
You're 19 years old now, that it's going to be a good time for you to learn how to draw up insulin and administer it yourself.
Huh?
Well, diabetes is a disease that's managed by insulin administration, and there comes a point when you really need to take control of your disease and take control of your medication regimen. So the first thing I'm going to teach you about is how to draw up insulin. Okay? So you have your insulin, you have an alcohol swab. You always want to make sure you're gloved and you've washed your hands too. Washing hands and wearing gloves prevents any spread of germs. So, we're going to swab this from the inside to the outside.
Why from the inside out?
We're going to do it from the inside to the outside to prevent introducing any new bacteria from the outside to the middle. It keeps it sterile.
Oh.
And it also needs to be dry. Because whenever the alcohol is dry, it means it's sterile. If it's still wet, it's not sterile. So, we now have sterile insulin. And this is your insulin syringe. So you're going to open it up. And you're going to take the cap off. Now today we're going to administer 3 units of insulin. So the first thing you would do is draw back to 3. You see where it says 3 right there?
Mm-hmm.
Okay. And then you're going to take it and inject the air into the insulin bottle. You're going to turn it upside down. You're going to draw back 3 units. You see where that says 3 units?
Mm-hmm.
Okay. Alright, Sarah, the next step, now that we have your 3 units of insulin drawn up, is going to be to teach you how to administer the insulin to yourself. There's a few different sites where you can give insulin. You also want to rotate sites. You don't want to continue to give yourself insulin in the same spot over and over.
Oh.
It's not good to do that.
Okay.
Okay, so I'm going to demonstrate on this pillow how to give insulin, and then we're going to let you actually give yourself the insulin later, okay? Now, the first thing you would do is swab the site. Do you remember how we swab?
Inner to out.
Inner to outer. So we're going to swab. We're going to let it dry so it'll be sterile. Okay.
Can I blow on it to
No.
make it dry faster?
Don't blow on it, because sometimes whenever you blow on it, you can get bacteria on it. It has to dry on its own. Okay. Now that it's dry, we're going to give the insulin. Take the top back off. And we've already drawn up our 3 units. So, you would pinch, and you would inject at a 90-degree angle. This is going to be straight up and down. Now sometimes for a thinner person that doesn't have a lot of fat on them, you could do it at a 45-degree angle. But typically you can do it at a 90-degree angle. Okay, so you're going to push it into the skin, and then you're going to push down on the syringe, pull it out, and then let go.
Miss Merritt is suffering from signs and symptoms of hypoglycemia.
In here, I'm sweating so bad. I'm shaky. Get out of here. Get out of my room.
Now, Miss Merritt, I have a few questions for you today.
Okay.
Do you know who you are?
Aretha Franklin.
Aretha Franklin.
Mhm.
Okay. Do you know what today is?
It's sometime in 1962.
Okay. Do you know where you are currently right now?
Yeah,
Where are you?
I'm on the moon.
Oh. Okay, Miss Merritt. When you start experiencing hypoglycemia reactions with the excessive sweatiness and tremors, one thing that can help prevent that or bring your blood sugar level back up is having some orange juice, having a little small thing of ice tubing, or a few pieces of candy.
Oh, but I like candy.
You like candy?
Mhm.
The important thing is to not eat too much because you don't want to become hyperglycemic. Just enough to bring your blood sugars back up.
Okay.
Okay? Do you understand?
I do. I understand what you're saying.
Okay. Now, have you ever experienced any headaches or mood swings?
Yes, a lot.
Okay. That's when you're having moderate symptoms of hypoglycemic. And usually what will correct that problem is glucagon. Have you ever heard of glucagon?
I think so. I think maybe at the hospital.
It comes in a little packet. They look like little chewables, and you can take one of those and eat them.
Okay.
Okay? So you would take that instead of the previous snacks that I listed before, because now you're experiencing moderate symptoms.
Okay.
Okay?
I get it.
Sarah is experiencing signs and symptoms of hyperglycemia. Enjoy your breakfast. What's the matter?
I'm just so hungry.
God, I'm so thirsty. So how are you doing today, Sarah?
Well, I do have a few concerns. Recently, I've been having frequent episodes of nausea, vomiting, and diarrhea, and I don't know what's going on.
Okay. Those are signs and symptoms of hyperglycemia. It's where your body has more sugar than it should and not enough insulin. And because you're experiencing nausea, vomiting, and diarrhea, it's causing you to become dehydrated. And that is the main reason why you have diabetic ketoacidosis. So the very important thing that you need to do is stay hydrated because you're putting out more fluids than your body is taking in.
Tell me, on a daily basis, breakfast, lunch, and dinner, what do you usually eat?
For breakfast, I eat bacon, sausage, scrambled eggs with a lot of cheese.
You have both bacon and sausage?
Yeah.
What do you have for lunch in one serving? Like in that one day, what do you eat for lunch?
Japanese food.
Japanese food? So what kind of Japanese? What does it consist of? Like a lot of vegetables?
Rice, and a lot of teriyaki sauce.
A lot. And now what about dinner?
Smothered pork chops.
Smothered. Okay, now how is your active lifestyle? Do you exercise a lot?
No, not at all.
Now,
I don't have time to exercise.
And I have to tell you that your eating habits are very, very, very horrible. Now, for a woman who doesn't exercise and eats smothered pork chops and Japanese food with a lot of teriyaki sauce and eats lots of pork products, that is very bad. Now, your diet consists of a lot of sodium. And you know what sodium does in your body? Sodium is salt, and what it does is increases your blood pressure. And when your blood pressure increases, you can have a lot of serious, complications. Now, for someone your age, your size, and exercises as much as you do, you want to have about 1,200 to 1,600 calories a day. which means no more smothered pork chops, no more bacon and sausage, no more eggs with cheese, and no more teriyaki sauce.
So what am I supposed to eat?
Well, there's a lot of things you can eat. Now, you can eat, for breakfast, you can have a bowl of oatmeal and some fruit. Yeah. You can put, and there's different kind of oatmeal. You can get cinnamon sugar oatmeal. You can get brown sugar. You can get any kind of flavor in oatmeal. Just oatmeal is really good for you. And then have a piece of fruit. Grapefruit is always good. And some milk or some orange juice. And then for lunch, you probably want to have maybe like a sandwich or something. A turkey sandwich with lettuce, tomatoes. Try not to use mayonnaise. Find substitutes. You can use, let's say, honey mustard sauce instead. Yeah. And for dinner, that smothered pork chop, it's gotta go. You don't want to eat such a heavy meal at such a late time in the day. You'll just sit there. And since you're not very active, it's not really good for you. Now, in the serving, you should have about 3 to 4 carbs. And you know what carbs are?
No.
Carbs are things that break down into sugar. And sugar in your body is like the energy. It's like gas for your car. It keeps you going. Things like orange juice or peas or corn, oatmeal, cornbread, things like that.
So anything that's healthy, pretty much.
Basically, you want to keep that in your diet. Now, do you know why your diet is important to your blood glucose level?
I guess to keep me out of the hospital?
Yeah, that. But what you eat, when you eat, and how much you eat all affect your blood glucose level. Like I said before, the blood glucose is your main sugar that's found in your blood, and it's the body's main source of energy. So if your glucose gets too high and if you eat too much, that can cause your blood glucose to get really high, and it'll bring you back into the hospital because it'll make you sick. Or if it gets too low, and if you're not taking the right amount of medication, it'll also make you sick. Well, today my nurse taught me some good things. She taught me why I need to take my insulin, because my blood sugar gets really high and my body doesn't produce the insulin that it needs to bring my blood sugar back down. So it's really important for me to take my insulin. And yes, I am 19, and it is time for me to take responsibility and start administering my own medication. I need to rotate the sites in which I inject my insulin.
Today, I have learned about hypoglycemia, the mild and moderate to severe symptoms. Mild symptoms of hypoglycemia can be shakiness or sweating. Moderate symptoms can be mood swings and irritability. Severe symptoms can be seizures, disorientation, or unconsciousness. If I exhibit any of these symptoms, I should have orange juice or granulated sugar. If they get moderate, I should have glucagon. If they get severe, I should go to the hospital.
So I talked to the nutritionist today, and she told me a lot about my diet and exercise, that I can't eat what I was eating before. All the things I was eating was very unhealthy and high in salt, and it was also causing my sugar levels to go up. She told me that the most important thing is for me to eat a lot of vegetables, a lot of fruit, a lot of fiber, and also to have some carbs in there as well. And she also said that it's very important for me to exercise 3 to 5 times a week for at least 30 minutes, and that I have to stay active because that'll also help with my diabetes and to keep me out of the hospital.